We have distinguished guests from NEI, DBT, DST, and we'll begin the session at the outset. May I request the chairperson, Dr. John Prakash, to please come up here. Dr. Sandra Tuminia is unfortunately not been able to make it, and Dr. John would be presenting on behalf of her. So, and I would also like to request Dr. Ronnie George to please come here. Dr. Lalit Verma, sir, please. Please, sir. Okay.
It's fine, I can go there too.
Yeah. So Dr. Natarajan would be joining us shortly. We just got a message from him, and in the interest of time, I think we can begin with this session. So, as you all know that, NEI at NIH has had a very long-standing relationship with India, and there are several research collaborations. Many of us present here have had the opportunity to train or work in different capacities at NEI and NIH. So the objective of this session is to collaborate and to see what we can do to further research in the different directions. So I would request Dr. John Prakash to please start with the first presentation. Yes. So Dr. John Prakash really needs no introduction, and he is a world leader. He is currently the director of the Office of International Affairs at NEI, and he has also done a lot of exemplary work in genetics of eye disease. And we are excited to hear from him what is going on in this area. So over to you, sir.
All right. So good morning and namaste, and greetings from National Eye Institute. And thank you very much, Bhavnaji. Thank you very much for your continued collaboration and assistance. And want to thank our good friends, and Dr. Lalit Verma is here, and he always gives us an opportunity as the scientific chair of this All India program. And this gives an opportunity to come and talk to you. And the goal is to essentially to expand Indo-US collaboration. We've gone through some ups and downs, rocky relationships in terms of work, but we are making progress. And I'm so glad Dr. Ronnie George is here. He's just done some very pioneering work with us, with our PIs, especially with Dr. Janie Viggs. So and of course, Dr. Namrata Sharmaji is here. She's been a great pillar in terms of supporting our collaboration. So it's and let's make it also my style. I'm very informal in terms of everything except just putting on a tie. So I would encourage all of us to really stop me anywhere and have an informal discussion on any topic that relates to Indo-US relationship. And also want to bring the greetings from Dr. Sandra Tuminia. She is the acting director of National Eye Institute. We have a change in leadership. Recently, Dr. Paul Sieving, who's been here before, attended and has visited India a few times. So he recently stepped down, left, and Dr. Sandra Tuminia has stepped up to serve as acting director until there is a national or international search that's going on. So we expect to have a new director hopefully in about 3 to 9 months. That's what they tell us. But until then, and so that's how she wasn't able to make it here last minute, leadership issues, but she's literally and sends her personal greetings to all of you, and she's just conveyed that to me again this morning on a phone call. So Dr. Bhavnaji had an opportunity two of us met with her about 2 weeks ago, just before you came to, and we talked about this session, and she essentially says that she is fully supportive in her leadership's time with the Indo-US relationship. So let's just quickly go through a summary of where we are in terms of Indo-US relationship. So this I always like to put this, that opinions expressed are my own. And many of you know, many of you have been to NIH campus, and some of you have not, are yet to come, and please do visit. Clearly, this is our campus just outside Washington, D.C. in Bethesda, Maryland. And as you can see, what we like to point out is that it's an agency of the United States government under our so-called Ministry of Health. We call it Department of Health and Human Services, that conducts and supports medical research to uncover new knowledge. And what I like to point out on a global scale is that, as you can see, this is the agency stands to help improve the health of all Americans and the human condition throughout the world. So clearly we are interested, I mean, it's your issue, it's our issue, and we work together. And there are 27 institutes within NIH, so National Eye Institute is one of the institutions with our goal is to conduct and support research, training, health, the information dissemination, and other programs. So three main goals, as you can see, that supporting research, training is a big part of it, and dissemination of information. So clearly that's, and that whatever that needs in terms of supporting and in respect to the blinding eye diseases, any kind of visual disorders, mechanisms, basic and clinical applied research, and any health-related issues. So all comes under, and NEI at this point is one of the medium-sized institute with a budget of close to $825 million per year. The overall NIH budget, many of you know, is $42 billion. And so clearly, wherever this money goes, that sets the direction for worldwide direction for research and training. And so what NEI does is clearly makes a big impact, not just in America, all over the world, so that's something to remember. Okay, so this is this year's appropriation budget is over $820 million. And so we know that many of you are experts in various areas, and but I just want to point out that we have a big task ahead. There are over 39 million people around the world, blind, 250 million or so not able to see, and but clearly the developing countries, especially the Asian countries, they shoulder the biggest burden. So therefore, we are trying to get very involved in doing and working with not just with India, Southeast Asia, and Asian countries. And we'll, as the day progresses, there are other sessions that will expand on that goal. We'll talk about it. One of the sessions is a Global Eye Genetics Consortium, which many of you are involved and are making contribution. So we'll discuss that on a global level in those sessions and how we can all collaborate and work together. So clearly a basic strategy, a coordinated strategy for basic science as well as applied research has to be there in order to reduce the global burden. So what is our view? At the National Eye Institute, which is, some people like to call it an apex of basic eye research, we support a huge amount of, close to 85% of our budget, which is over $600 million, just goes in terms of grants, just supporting PIs, not just in the US, all over the world. And as you know, this is an agency's grant called R01, which anybody from any part of the world can really literally apply. So all we are looking for good science. Okay, so we believe the global science is interconnected, and we are very actively involved in global research, seeking, in terms of seeking scientific opportunities, identifying our shared priorities, or finding unique opportunities. That India does have a lot of unique opportunities, and I'm so glad Dr. Ronnie George is here. He's done outstanding work on very unique patient population, working with some of our leading investigators in the U.S. So in terms of finding and working on the partnership among scientists, governments, companies, NGOs, and in order to leverage the NIH funds. So this really working all together, this even grows further, more than one can imagine in terms of putting an impact on global research. So as I said, the final point here is that anyone from any country around the world can apply for NIH science grants, okay? And you can just go on the NIH site and get more information or contact me. So, so this is just a footprint in what has happened last 4 or 5 years. This was our footprint in 2015 and 2016, and then 2017 and 2018. So clearly our footprints, NEI's collaborations are expanding. I don't like to claim that it's all because of my efforts, but it has been a tremendous journey working with people from around the world. And you can imagine India is just one country under my portfolio, so, but it is a very important country that we work, and there's just a amazing part, what I see, that, you know, Indian investigators, Indian scientists, they inspire me. And I have said that openly, that even I had a meeting with your Department of Biotechnology senior leadership and the embassy people, and I keep telling them that, you know, we work with India and Indian investigators because, so I'm going to take Dr. Senator Tuminia's time as well. So this is a combined joint talk. Is it okay, Madam Chair? So we have this, as you can see, that a number of countries right now, active collaboration, and a number of projects that growing from 30 to 177 in just 3-4 years. And it's even more, so the current data is being compiled as there were some database issues just before. So we are just kind of showing a trend which is really expanding, and there are more and more people are interested in working. So these are just some of the summary of international program activities. These are our relatively big program, US-China, of course, you can imagine that, and we do parallel funding support, US-Indo program, which is, we are working with your DBT, that's your nodal agency, and that's also a parallel funded program, and US-Brazil, US-Ireland, and then we started International Genomics Fellowship, which is, we have expanded from 1 a year to 5 genomics fellowship, and interestingly that, and as expected, the very first recipient was an Indian, Dr. Shalja Tibriwal at Shroff Hospital. So she was trained with us a few years ago as being the very first fellow, and so she is doing some amazing work. So global programs are making impact. And we just started another new fellowship, which is a ICO fellowship, working with NEI ICO fellowship. And I'm very pleased to announce that the very first recipient is also an Indian, Dr. Mayank Balsal, and let's give him a round of applause. Dr. Mayank is here. He'll be coming to, he's the very first recipient of this most prestigious fellowship, which we just started and signed. The deal was signed with ICO president at the last ARVO meeting in Vancouver. And this is a global competition, and Dr. Mayank Bansal's credentials were presented among the other 3 top candidates, and we had an interview panel, so we selected him, and he's right here, and he'll be joining us in a few months. National Institute also started a program that many of you know. It's called GEGC, Global Eye Genetics Consortium, and this we'll have a session on that right after this, I believe in this room. So, and then the other programs also include, you know, a large intramural collaboration with the UK and several other countries. In addition, we have continued postdoctoral program, which is like a long-term research fellowship program. That is very principal investigator based, and there are more than 20 labs that specialize in various kinds of intramural research, and we have many Indian scientists that have been trained, that are being trained, and that will be trained, I have no doubt, in the future. So that's one thing. If you're interested in a long-term fellowship, this is something to look at. And then we have visiting fellows and visiting faculty, senior leadership, and I'm very pleased to mention here Professor Bhavna Chawla, who's served as just very recently as a visiting professor, visiting scientist, and spent some time with us just recently. And I'm delighted that she's moderating the session. So it's always a pleasure to see participation of India at various levels, short-term fellowship, long-term fellowship, prestigious fellowship, visiting professorship. In addition, we have numerous Indian scientists coming and walking the corridors in the building of National Eye Institute. The very frequent visitor, your AI, now the past president, Dr. Natarajan, he's there several times a year and has personal relationship with many of us. So he keeps reminding us that, look, India is very active. Indian science is very active. So we thank you for all that. So let's move to. So Global Eye Genetics Consortium will have a session right after this. And I'm also delighted to see Professor Paul Baird from Melbourne, Australia. He's just arrived. He's sitting in the back. And I'm assuming that Rajasthan was good for you and your family. So welcome, Professor Baird. And we'll have the next session on that. So let's keep this slide for the following session. So this was the International Genomics Fellowship. We are now doing 5 a year. And it's all, we expanded it from 1 fellowship to 5, and everything is all paid for in this. It's also a global competition for LMICs. And but I would encourage many of you to spread the news, spread the word, and so that we continue to get good fellows who can actually come back and do continue or start new work in this part of the world. Okay, so this is my contact information. Please feel free to contact me for anything. I'm here throughout the meeting. I would be happy to meet with you. So I'm going to stop here. And as I said, can we, Madam Moderator, can we do just an informal, if there is any questions, right?
Sure.
Okay.
So we're happy to take questions, if there are any, for Dr. John.
Are there any questions, anything? Yeah, that's the goal. How did you hear about
maybe a word of mouth or yeah.
So you have been looking for the new fellowship responsibility went to ICO. We gave them a contract. It's called sole source contract.
So what I'm saying is the penetration of this knowledge that this is all is available has to be done more. Because the reason is that I also travel quite a bit. A lot of people are not aware that all this can be done. And believe me, talent is abundant.
Yes.
It's just that you tell them, they will explore.
Yeah.
So maybe we can put on our website that this is available.
Exactly the idea of what we discussed last night with some of the leaders.
Yeah.
How do I tell people all over India?
No, but I have taken a couple of pictures from here. I will try and put at least this is available. Let people contact you, or maybe Bansal is there, so they can become your vocal for information.
Excellent. Let's work with your team.
And same is true for SARC also, because you see so many developing countries are here. SARC session is going on, and if this information percolates, ultimately it is good for science and.
That's our goal.
Because your first slide said that for the entire world.
So now these things are they have come in since I joined, started speaking, and I'm actually thinking of more fellowship. So but I don't want to give out.
Honestly, all these budding scientists and all, they are just wary of the fact that they go, who will take care of the travel, stay, all these things, because you see, I have personally gone through all this. So that is what keeps them down.
So this one is both these fellowships are short term, because some people cannot get away from us.
Maybe we can put some interviews of Bhavna, Mayank, and how is their experience. This may, audiovisual, they will motivate other people also to explore, at least explore.
Oh, I'll be more than happy to do that. Yeah, as a first-hand experience, I totally agree with Sir that there is lack of awareness and abundance of talent. So we really have to make this information freely available to everybody, and I'll be more than happy to do my part of sharing my experience and like mentoring whoever is interested. fellows, residents, everyone, so that, this program achieves, the potential that it actually has.
Yeah, I mean, your place, as you can see,
Yeah.
Dr. Bansal is coming to us, and your place is one of the largest training facility in the world, actually.
And AIOS is also an excellent platform to take this up.
Yeah, so
Because it can really reach up to every through.
something a link directly on AIOS website.
I think I quite agree that it's not publicized as well. Even when you send for that Indo-US collaboration research project, even that people miss, because probably we are not able to take it across to the people who are interested in research. I don't know, somehow it appears it's very difficult to get NIH grants, or the word NIH kind of intimidates people. Or to, of course, Ronnie George has done it, and I'm sure.
Right here.
I know, he's sitting beside me, but.
He has done it.
But
Dr. Bansal is here.
yeah.
John, what I would suggest is that, Ronnie is here, Namita is here, the leadership is right here. So we say, here is the man, by your this thing. You can, 30-second clip that I welcome everybody. And then Bhavna and Mayank can put in that this is really useful. And Ronnie can, put in his clip there. This will motivate. You see, once you click on that and see, oh, ये तो possible है, ये तो कर सकते हैं, तो why not?
So let's do it then. Whatever two of you decide that
No, I will, we'll sit together and try to take this forward.
leadership, I mean, we are
Yeah,
happy with an interview clip from him.
No, now that we know, we'll take it forward.
Good. Thank you very much. Anything else? I'm happy I'll be hanging out. The next session is on GEGC,
So, as you all know, at ARVO, there is a interest group session where they talk about, someone from NIH or NEI comes and they talk about what is the process of applying for grants and how not difficult it is, because I attended that many years back and I found it very helpful. And so I think at AIOC as well, something like that can be organized where Dr. Bhavna or when Dr. Mayank comes back, they can talk about it and organize a session telling them what is the process of applying to the grants, and it's not that easy, it's not that difficult as long as you do the proper science. Yes. Yes.
right? And you went from here, right?
Absolutely.
Sort of the mid-career sort of thing. So it can be done.
Yeah.
All the examples are out here.
Sandeep Rover. I just want to add that this program, the ICO and NEI, is a very beautifully conceived program, because I strongly believe that translational research is going to have more and more importance. We have very strong clinical work that's going on over here, but the translational aspect is something which NEI pioneers, and that's how I think this is going to be very fruitful for all of us here in India.
Thank you. And interestingly, the people you will be working with, Rama Chawla, just spent some time working in the same lab with Dr. Bhatnagal and Brian Brooks and all that. And would you like to tell us about your experience? That you did some data work, some clinical work. Right?
So, I mean, first of all, I would say that, there is no age to start learning. Learning should never stop. It's a lifelong, pursuit. And I was kind of, when I went to NEI, I was sort of overwhelmed, with the kind of translational research that goes on there. And I always felt that, India is one place, we have so much of clinical material, but we are not tapping it enough. And, it is very important to, incorporate collaborative research in our clinical practice, and that is the way forward. So I had a wonderful experience working with Dr. Brian Brooks and Dr. Rob Hafnagel. They are pioneers of the iGene project, which is how they have put together, the entire genetic sort of information and data for all the US citizens, and they're trying to emulate it in different countries. So I was very impressed by that kind of initiative, and I think that can be used as a model for India as well. And of course, it was a very rewarding and productive experience. And with Dr. John being there, I never felt I was away from India for even a minute. So it was like a home away from home for me. So, so he was always there for any issue, any help, very friendly, very welcoming, very warm. So it was a wonderful experience to be there.
It comes from the leadership. So you can imagine that the relationship Dr. Paul Phoebe enjoyed working with Indian scientists collaboration, and it has all translated into bigger and bigger programs. We had to start from somewhere, and I remember coming here a few years ago, and all these ideas have evolved, and we had just kind of, I get the idea from you, and then I go and add more fellowships. So I'm starting like just the last 2 days being here, both the evenings, and now I've come up with another idea about an international fellowship very similar to the ICO fellowship. This will be global health and other areas, including AI and all that, because India is doing technological advancement. We are very interested. Why don't we create a future in AI and global health? And how do we get the big data and retinopathy and all that? And so I'm still just started working on it. If you have any idea, anything, just send me an email. What do you think of this idea?
Yeah, so I mean, I'd just like to, I've been fortunate to get some funding from the joint program a couple of times, and that was partly because we had a relationship with our collaborators, Dr. Nei-Nih to start with, and getting the second grant was that much easier because we had a history of working together. So both funding agencies look for a history of working together or a history of having published together. And this becomes a challenge when you are applying for a grant for the first time. So you have met somebody, you have an idea, you actually have good material, they have good science, and you can do things together. The challenge comes in not having a publication together and not having a joint, sometimes joint lab work together. So that becomes a challenge in India because even if we want to generate preliminary data on, let's say, a new laboratory technology, which is available only overseas, ICMR does not give you permission to ship a sample. Even if it is just 2 samples, you just need to generate that, yes, you can detect whatever you're trying to detect in that sample in the new technology developed there. So when your grant comes up for funding, the question comes that they haven't worked together. They have not been able to ship a simple single sample across. Therefore, how do you know that this grant is even feasible? I think this, we need to, at least at the Indian end, we need to find a way of solving this problem.
Can I say something? I think I agree with Ronnie George completely because I have the same personal experience. We're trying to write a collaborative grant with the Miami Baskin Palmer Institute, and they say that you don't have publications together. Now, if you want publications together, then you need to do studies together. And then again, the same thing, the samples have to go. Now, we were doing a study on infectious keratitis where we had to send samples. Now, it took me 2 years. Eventually, we did manage to send the samples through ICMR because ICMR has this, and again, through personal contacts, it was possible. But it took 2 years for that to materialize, all the permissions and everything.
Yeah.
Then after that, it happened. But what I'm saying is it's really tough. For genetic analysis, it will be tougher. This was for microorganisms and so it doesn't make too much of a difference. But this is a huge, you can say this is the biggest limiting factor as far as the genetics studies are concerned.
Okay, so get a microphone here. So let's look at there are a lot of good things that are working. Just 3 days ago, I was with the senior leadership of DBT in their office, and I expressed all the frustrations what I just heard from you, Dr. Namrataji, and they said, look, number one thing that you're very committed and we are very committed, that's DBT. They're very committed, and they want to continue the program. I even said that some of these frustrations, my people, program officers, they tell me that let's walk away from this. And I said, I'm not going to leave the table as long as I'm the director for the international office. Not just because I'm of Indian origin, but I actually get inspired by the Indian investigators who walk through my office. People like Bhavnaji, stops by and tells me the kind of things that are happening. Dr. Natarajan, he's like constant figure. He comes around. And then many other scientists and collaborators. So I tell them that, look, there are issues. Who doesn't have issues? Big governments, India and US government, two huge bureaucracies, of course, right? But there are many good things that are happening. So we have continued, and there's no reason to get discouraged. Your DBT is very committed. Your ICMR Director General, Professor Balram, was there just a few months ago, back in July. And he said, well, you're already working with DBT. If you need any help from ICMR, Gyan, come to me, right? I've known him for a long time. So at a very high level of your leadership, They are all committed. But the question is that whatever you want to get in India, you have to do it. I've got, I serve people like Dr. Grover. He's my taxpayer, right? He pays my salary. So that's my first goal, right? Yes, I'm very nice to all of you because you all come. There's always a masala tea in my office. But the question is that you have to take things in your hand. You have to go to DBT.
So one trick I can tell you, when this ASIC study was envisaged, RP Center was not a part of it. It was between LVPI, Arvind, and these were the only two centers. And they did this study with them. And then 2 years down the line, the samples were all collected, everything was done. They realized that they cannot be transported. There were 2,000 samples which had to be transported from India to Singapore. So then they, collaborated with the government sector because it's easier to get it through the government sector. Then we came into fray, we started doing the study. And finally, when our samples also got collected, then a combined application went, but the main applicant was, a government institution. And then that, finally went through. So it's always good to have, when you're doing especially multicentric studies, good to collaborate with a government institution, because then if that government institution becomes a main applicant, then it's slightly easier, rather than, private institutions, especially for transport of samples.
So transport of sample is I call it your national issue, right? China has the same issue.
No, yeah.
Right? So but there are ways to, and people at Shankar Nethralaya, researchers at Shankar Nethralaya, they not only have one continuing project with Dr. Rani George, but also another one, you have a large program on diabetic retinopathy with Dr. Sudha Iyengar at Cleveland Clinic with Dr. Mathwan, right? So they know, they have figured it out, they have cracked the code. Interesting thing is that my boss my boss's boss actually, Francis Collins, he says, one thing for sure, if you don't apply, you're not going to get it, right? So you have to make an effort. There's no reason to get discouraged. But there are ways. You should get DBT more actively engaged. When they tell me day before yesterday that they are very committed, that's all I can tell you at this point.
See, I agree that there are ways of getting things done, but the way things work is you have to have preliminary data. So if you have preliminary data and the grant gets funded, once you're funded, ICMR does let you move samples across, provided part of the work is done in India and you can show that what is going to be done in the US cannot be done that easily in the country. Right. The challenge comes when you are trying to generate preliminary data, because you don't necessarily have a grant to work on a preliminary data and you don't have a funding mechanism at the Indo-US level to generate a small amount of funding to do that. If you have a sanctioned Indo-US grant under which sample transfer is allowed, it's not a problem.
Yeah, but to think about it, what you've done is essentially you have figured out what other things that can be done in India, right, which you and Janie Wiggs have figured it out. So, and if it involves shipment of samples, I have been told that X% of samples can be transferred.
That's a very small percentage.
Right.
That's a very small
And if that is good enough to generate a preliminary data,
No,
it is not.
It is not.
It is not.
No, even that can be generated only once you have a grant. For preliminary data, you cannot transfer
That's
samples.
a huge challenge.
So the way we worked with Sudha was different. We had genotype data, and she being a statistical geneticist, she could figure out with the genotyped data, just the statistical data, we could manage to get some preliminary data out. But if you're trying to do something new, this is a roadblock.
So also you have to think of, there are kinds of projects that you can do here or in collaboration. If you try to do everything what can be done in the US, why would US taxpayer pay for that specific piece?
Yeah,
Think about it.
And what they encourage is that all the genetic analysis you do in our country itself, like you're saying, why would they pay for it?
Right.
And the samples don't go there. So that is a problem. Then collaboration is only on the clinical aspect of the phenotype, not on the genotype.
Okay. And here again, I'll just put it out there because unfortunately, Indian funding agencies don't recognize the importance or the value of the clinical phenotype.
I'm not going to comment on that.
Yeah. So I don't
sure.
expect it, but I have friends out there, I'm sure, who
But,
agree
but
with me.
again, DBT tells me at a very high level meeting that they are very committed. ICMR is very committed. And fortunately, I've been part of, even at a higher level, representing U.S. government in health dialogue, U.S. Indo health dialogue. So for the last two ones, they've invited me. I've come, with the at our Ministry of Health, so I've come here. Besides AIOS and AIOC, there are other opportunities which I see, being the advisor to our ambassador. So I've sat in those meetings. I've also attended the meetings in Washington D.C. at our Ministry of Health, and even at the very high level, very very high collaboration. Everybody is committed. Both the countries have such a wonderful relationship. You can see our president is coming in just a few weeks, right? So I'm going to stop here. I'm available all day, the rest of the meeting. Let's continue the dialogue. This is very encouraging. But I tell you, you have, again, all examples are right here, within like 20 feet, 10 feet. So there's no reason to get discouraged. You have to do your part. We're doing our part. Okay? Thank you very much.
Thank you, sir. That was really an excellent talk and very motivational, and I'm sure everyone sitting here is feeling inspired and encouraged to come forward and use this opportunity. So may I request the next speaker, Dr. Ronnie George, to please come up for the presentation.
The next session is
GIGC.
I have actually said most of what I wanted to say. So I will just, I get this, I thought I'll just answer the question to a few people in the audience who come and ask me, how do you go about doing this? And the way you go about doing this is talk to somebody. And don't talk to somebody 3 months before the grant deadline. Preferably talk to them a year and 3 months before the grant deadline. It'll take you that long. Because 3 months before the grant deadline, you're not going to be able to get anything done. And at least if you have that much time additionally, when you go to the US for a meeting, you visit them, you see whether there's something small that you can do together, and that is actually enough to get started. The second is we have roadblocks at the Indian level, and Dr. Namrata was kind enough to say we'll try and fix up a meeting at the Indian level to see whether we can answer some of these questions with our funding agencies. So if that happens, hopefully things should become easier. Otherwise, I can only say thank you to NIH and the US collaborators who have been very open to working with us and who have been very open to ideas and who have put in a lot of hard work towards getting the grants done. And I'm sure last year, I think we had 23, 24 grant applications, and that's a lot of work which goes in. Even if it doesn't get funded by this route, there are other ways of getting it funded. So that's all that I actually really wanted to say. The rest were mostly complaints which you heard.
So thank you, Dr. Ronnie George. I think clearly the issue here is that transport of specimen, having previous relationship, and the point you brought up that don't start your project just 3 months before. You have to show some collaboration. And interestingly, many people, I get so many emails from India. आप हमको बताइए किसके साथ हम काम कर सकते हैं. You can think about it. Please tell me, who do I work with in the US? Now, think about it. First of all, I'm not allowed to tell a US investigator who they should be working with in India, and how can I tell an Indian investigator who they should be working with in the US, right? It's illegal to me. For me, it's all U.S. investigators, we serve them, right, Dr. Grover? So clearly I cannot make that statement. So I tell them that, you have the whole scientific publication and your interest, and go to your meetings. You meet these people in the U.S. meetings internationally, and you should be able to find your own partner. But let's not do it before 3 months. So this has to be a genuine interest between you and your partner, and as well as the mechanism that Dr. George described. All those things have to be in place. You next.
So anybody has any questions for Dr. Ronnie? We can move on to the next speaker. So, is Dr. Raja Narayanan here? He's not here.
No, that's fine. Don't worry.
And Dr. Sundaresan also not here.
Sundaresan is not here.
Dr. Abdul not here.
Okay, so we have.
So we have Dr. Sandeep Grover from University of Florida, and he's a collaborator on this program, and he will share his experience and tips with us today. Welcome, Dr. Grover.
We'll just continue. That's this. We'll start early. 9 से 10 25 इसी हाल में
Thank you.
यहीं पे 10 30 से ये.
Well, thank you. Thank you to the committee for inviting me, Dr. Natarajan, Dr. Lalit Verma, Dr. Bhavna. I went from India to US in 1993 after actually practicing in Delhi for 3 years, and then spent some few years doing inherited retinal diseases and electrophysiology with Jerry Fishman at Chicago. Then did my residency again in US from University of Illinois, Chicago, and then did medical retina fellowship. Then I went to Jacksonville, Florida at University of Florida, where I've been there for now almost 15 years. So I've been indirectly involved with NEI and NIH all these years through Foundation Fighting Blindness, through Diabetic Retinopathy Clinical Network, which is mainly funded by NIH. And I just wanted to talk briefly about this network and how this, maybe we can conceive some idea of bringing that kind of a network in India, because I think with the population of diabetes patients here, we can get some answers much faster than we can get it in US. So this diabetic retinopathy, it used to be called Diabetic Retinopathy Network, and all the protocols were for diabetic retinopathy. But recently, just last year, there was a demand for just not keeping diabetes, but other retinal diseases. So the name was changed to DRCR Retina Network. This is actually available on, these slides are available on the public site of DRCR. Anyone can go to it and learn about it. So I'm not representing DRCR or University of Florida for this. So the DRCR Retina Network mission is to improve the lives of individuals with, used to be diabetic retinopathy, but now it's with retinal pathology, by performing high quality collaborative clinical research. So the most important part is the collaboration, and the other important part is the network quality of this organization, which is one of a kind. And so there is a collaborative network between the network itself, the organizing, the committee, the network chairs, and then the clinical sites, which there are 509 current investigators from more than 170 sites. And then there is a coordinating center which kind of coordinates all these protocols. And obviously nothing can be done without funding, and NEI is through, is the main funding organization for this, these projects. And of course, to some extent, the National Institute of Diabetes and Digestive and Kidney Diseases also funds these projects, but it's mainly by the NIH. And this is, there's a collaboration with industry as well in the last few years with all these anti-VEGF, the injections that are available now. And so the industry has been very kind to actually supply all these medications for holding these trials. So this is just a brief look at the network. There are about 158 active sites as of last year, and there are 493 investigators that are active, although total there have been more than 1,000 investigators, and it's mainly in US and Canada. And any retina specialist in the US and Canada can apply,
and that is reviewed by, and if they meet the criteria of being an investigator, then they can be included in this. And anyone actually can submit a protocol idea, and I've submitted quite a few, and so I know the process that it's pretty easy to submit the idea, although obviously not all ideas are accepted because it has to go through a stringent process. So the review process, once you submit, and anyone submits an idea to DRCR.net, there's an initial review to see whether the topic is of public health importance and can it be done. And then the operations committee reviews, meets twice a year and reviews all these protocol ideas. And actually the submitter joins the meeting via phone and explains the rationale for why they want to have this particular protocol accepted by the DRCR. And the designated ideas then are presented to the investigators. We have two meetings, one winter meeting, one summer meeting. And this is presented to all the investigators and kind of a vote as to whether, if this was a protocol, how many investigators would be likely to join. So based on the operations committee and based upon how the investigators feel about it, the ideas are reviewed by the operations committee again. They finally make a recommendation to the executive committee, and then they make the final decision as to whether it will be accepted as a protocol to be run in the DRCR network. So the network started in 2003. I have been part of it since 2006. And as you can see, there are so many protocols that have happened since 2003. And these are the current protocols that are being enrolled. And I'm not going through each of the topics. I just wanted to give you an overview of how the DRCR runs. And then any publications that comes out of it can be found on the public website. And the top 5 enrolling institutions, the main authors come from that for any paper or manuscript that comes out from any of these protocols. And then it's not only the primary endpoint that is kind of published, but there can be so many other publications that can come out from these protocols. And just to give you an idea, we had a winter meeting last month, and these are some of the protocols that are in development that were accepted. So thank you for your attention. I just wanted to bring it to your notice that this is something that I actually talked to the DRCR people to see if they would be ready to collaborate with India to kind of, because they already are doing it, it may be easier for them to collaborate here, but they were not ready at the moment for the collaboration. But, you know, it can always be started. That's not an issue. So thank you very much for your attention.
So, Dr. Grover, yes, thank you very much for bringing the DRCR. As you know, it's a large program for NEI. We put a huge effort, especially our clinical group puts in Dr. Emily Chu and Rick Ferris, and yes, you know, they've essentially put in a big part of their life and career developing this. So this program is very important to us. And but last few days, just you know, talking to your people here, and also what Dr. Natarajan, your outgoing president, the past president, just immediate past president, and gave a presentation last night, and he's kind of doing very similar to, plus more, a diabetic retinopathy screening here. And I encourage that, you know, there are many people are getting involved in that. And I was thinking, listening to his presentation at the inaugural ceremony last night, that if there is some way that both the efforts can combine. And last Friday, when we did a symposium at Schroff Hospital, and we had a very nice discussion on, you know, the diabetic retinopathy and all that. Dr. Bansal was there. And there are families who have diabetes for 3 generations, and they're being treated, and they have never shown any signs, symptoms of diabetic retinopathy. So Are we going to benefit from that information? Yes, right? Is the world going to benefit from that information? Of course, right? Can this produce a drug for not having diabetic retinopathy? Imagine the scope of that.
Right.
And if the answer comes from India that Dr. Grover, people like you could actually really bring that knowledge and build a bridge between the two countries. So I would encourage you to really to at least sit down with Dr. Natarajan.
So I had a long talk with Dr. Natarajan
Oh, great.
in the Academy meeting last year.
Okay.
That's how this thing came up, and I presented this idea to him as well. So yes, I know about what he's doing, and
Right,
even more, as you said.
So looks like we need a champion in the U.S.
That's right.
That could be you.
That could be me. Yes.
Yeah, yeah. And without any champion,
Sure.
things don't go very far. So wherever I see, and I'm very fortunate to have the worldwide vision. I see many projects around the world, and unless there is a champion in that country, it's not going to happen.
Sure.
So
I
we are
understand
happy
that.
to support you.
Okay.
Yes,
Thank you. Thank
yes.
you. Thank you.
Thank you.
And I'm happy to collaborate with the investigators in India, being at University of Florida. I would love to.
Yeah. So maybe then
I have a couple of
Yes.
questions. The one is, I mean, it's amazing the work that the DRCR net does, and I think what's important is that your criteria are pretty objective,
Yes.
and I think that's the reason people collaborate. We have unfortunately not been able to get into that sort of a environment in this country till this time. The second question I had was, for example, one of the protocols you put up there was topical aquasuppressants. So there are certain costs in running the protocol at each center. As of now, are the costs taken care of at each center's level? Is it funded by the center, or do the patients pay, or how does it work?
Yes, so the patients don't have to pay anything, and we don't have to pay anything. So the DRCR will pay us for everything. For example, if there's a protocol where we have to do an eye exam, slit lamp exam, and then OCT and fluorescein angiography and wide field, so all of that are paid by the Medicare rates, whichever is existing, by DRCR. And even it pays for the investigator time, it pays for the coordinator time. So it's very objective. Whatever steps they say that at month 1, month 3, month 6, month 12, these examinations have to be done, that much payment is made. At every 3 months, the payment comes in to the department.
Well, that's a lot of funding.
It is a lot of funding, and thanks to NIH, it has survived, and NIH has been a big, big instrument in this. And every time we have a meeting, we don't forget to thank how NIH does that. Yeah. And the beauty of the clinical network is that it's not that you have to scratch your head as to whether you're going to give the treatment or you're going to give the placebo on that particular day. It's all live, that you feed in the examination findings, the OCT readings, whatever the questions are there on the computer, you feed those questions and the answer pops out saying, because all the protocol ifs and whys and hows have been already fed into the computer, so the computer pops up saying, well, the patient has more than 10% CME today or DME today, so they need to receive an injection. And you just inject, and that's it. So that is why I was saying that it's really one of a kind, and it's amazing how it has worked. And it started small in 2003. There were not too many investigator sites that were doing it, but slowly it has spread, and it is our choice whether we want to participate in a particular protocol or not. It's not like that you're a site now and that you have to participate in all protocols. So I just got an email yesterday about one of the other protocols, whether you will be interested in participating. So then they look at the sites and then they decide who to include.
Thank you.
Yeah. Thank you very much.
Thank you very much, Dr. Grover. That was really very inspiring. And I hope more and more people in India are sensitized to the need for this kind of collaboration and further progress in research in this direction. And are there any other questions for anybody? This is informal session, and we would like as much of interaction and discussion as possible. Anybody has any ideas that they would like to share or their own personal experience?
Dr. Ronnie, perhaps a few more details on the application process and collaborative R01 grant that you received.
Okay. Okay. So the application process, basically you have to meet both deadlines. You have to meet the NIH deadline and you have to also meet the DBT deadline. And it's been slightly different every year. A few years back, it was just a single grant application in the NIH format, which was submitted to both sides. The most recent application, you had to submit it in DBT format. You also had to submit it in NIH format. The NIH format was what went to NIH with a copy of the DBT application, and the DBT application was what went here with a copy of the NIH application. So this is a bit, it can be a little bit painful to do, and you have to be able to coordinate with your collaborators, because this is where many things are easier for us to do in India, because some of our, within an institution, some of our administrative processes are shorter. While in the US, some of these processes take much longer because their regulatory within a university is longer. So in terms of your CVs, in terms of getting all the approvals done, that can take a fair bit of time even prior to just submitting the application. So yeah, the application process is a little complicated, but most people on the Indian side have some experience writing to DBT, and on the US side they have experience writing to the NIH. So that's sort of, they guide each other through the process. It's not very difficult, but you need to give yourself time to be able to do it.
So just to add on that, so as you know, so the applications are, submission site will be open. The submission is due on, the last date is this year, it's the first week of November, changes from November 8th to November 9th. But what happens is, it's, the site opens as expected 2-3 months before, so that you can, if you are ready, you can start submitting it. But right now, the funding opportunity announcement, we call it FOA, is open. It is signed between National Eye Institute and DBT. You cannot submit it before certain date, but the opportunity is open right now because we have signed the deal under this current format, so for 3 years. So we did 2018, 2019, and 2020. So 2020 submission can be done starting sometime in August, September, but right now the opportunity is open. All the information is there. All the data, all what is needed is all there. DBT information is there, NIH information is there. If you want to start working today, Dr. Grover is here, a US investigator supported by a US taxpayer, sort of my boss. They're here. And if you are here in this room, you can certainly sit down with him and the collaboration can begin today. All right? And you'll go through all this process for the next 2, 3, 4 months, right? Or 6 months. And perhaps develop some preliminary data, develop something, do something in the next 6 months. And when the submission site opens in the US as well as here in DBT, you are ready. So this is the time. If you're really going to be in a position of Dr. Ronnie George, just like he had success, the time is now. You can begin. So I'm glad Dr. Natarajan has joined. Welcome, Dr. Natarajan, our immediate past president, and we have had we had a few more people here, and there was very lively discussion with Dr. Namrata Sharma and Lalit Vermaji, and there were several other people. So we'll give you, and we mentioned your name, that how wonderful relation you have developed with NIH, NEI, you were frequent visitor, and then also your name came just recently when Dr. Grover was presenting on his work at DRCRnet. And so we talked about you doing diabetic retinopathy screening, And we even said that there's some aspect from your talk last night at the inauguration that sort of gave me an idea that, why can't the DRCR people work with you under the Indo-US, some aspects of it. So both accomplished people are here, and this collaboration can begin right here. So we'll give you the podium to speak, whatever you would like to talk about Indo-US relationship.
Thank you, John.
You could be there, you're the speaker. So.
Good morning, and everybody, and thank you, John, and sorry for I apologize for the delay, but I'm happy Sandeep is here, and one I want to tell my personal experience here is that we are struggling with to do from our side, because I think to write a Indo-American collaboration project is not easy, more tougher than your own thesis what you have done, and I think you need so much of revision. And we are working with Sudha Iyengar from last 4 years, and I think finally we submitted in last year in November, and I think so one is, as John says, we have to be prepared now, because even why wait till the last week, because it's not easy. There are so many formalities, registrations to be done, you have to get acknowledgement in everything online, and I think only thing I found out is it's a fair review, and I think even in America, I think they have a problem depending on what type of project you write. If you write a genetics project, it goes to the cancer genetics and general genetics, and that's where the competition is too high. But if you write something specific, ophthalmology, like how, it's again a genetic project Ronnie has got, and I think he's got an excellent partnership. So I am discussing with Sandeep for the last 2 years. We are yet to begin. Why not we have DRCR India? And I think even DRCR.net in the US started as small, and it's totally an NEI-NIH project. And I think a lot of important people are involved in writing the project, and then they have got the going up to T, and the various protocols have been come out. I think we have to start somewhere in India, where I am also spoke to Neil Bressler, who was in the helm earlier, and everybody is ready to help, but I think from our side, we have to become strong, that is from Indian side. And I think DRCR has to start something in India, in whatever name you call it. And here I think at least we are proving now we are not working for any individual name. We wanted to collectively work as India. And I think India has the maximum number of diabetics. I see the other place is China, but I don't know whether they are organized in screening, diagnosing and treatment. I was there in the AVRS in Shanghai, and they claim Shanghai has totally AI for DR screening, but I don't know. I don't see publications, and I think the AI is working in India, and I'm happy we are working on offline AI, both online AI, but I think long way to go, and I think India has the great potential which other countries don't have, is the numbers, and then we know experts here to collect data. I think more important is robust data, and I think everybody is talking about big data, and if you have a big data, you're going to be a multi-billionaire, not even a millionaire. So I think that means India should become multi-billionaire, and I think with the data, and I think using AI, we have lots to do for diabetic retinopathy, then glaucoma, and also the neurological diseases, where I'm working with thanks to Dr. John Prakash for introducing to the Chinese eye genetic consortium. I went there twice, and Professor from Chongqing, I forget right now the name, his friend, our friend, he's actually asked for a project, the Indo-China collaboration on predicting Alzheimer's and dementia in using the AI in optic nerve. So we are in the process, and I think it's again a new challenge. And I think, is he working with you? I don't remember. He said he's working with somebody in India. I forgot his name right now. Anyway, I have it. So I think we also have Paul Bird here. We have Paul. Yes. So we are working with Sarah. We don't have any collaboration, but we are working with Sarah is the Center for Eye Research Australia in Melbourne, and his colleague or his student who's a PhD, Shrujna, has made a keratoconus international consortium, and I think myself and Aditya Jyot is a part of it. I'm not a cornea surgeon. The idea is to bring people together, and every time I learned this from John, saying that why we are all individually working, why are you doing your own individual cooking, why not we have one place to cook so that India is represented and not Maharashtra, Bombay, Delhi, like that. So anyhow, we have to solve that issue, and it's our own homework, and I'm happy John is also from our own home, and he's a great guiding spirit. And I think, Paul, we have one good news for you. The Australian embassy in India has, yesterday we had a meeting with the president of RANSCO, that's Dr. Professor Heather Mack, who's the president of Royal Australian and New Zealand College of Ophthalmology. The RANSCO is going to sponsor eminent ophthalmologists from India to go and give teaching lectures in Australia. So I think it's a good move, and I am happy I stimulated Nitin Verma to talk to the Indian Embassy, and I am happy we are also working with Dr. Bhavnas in Delhi. She should work with the US Consul General and the US Consulate. It's not only asking money, and I think the idea is the exchange program, and there are lots to learn and lots to teach, and I'm happy. Yesterday, our guest speaker from Singapore said, I come to India often because it's not only to teach, I learn. So I think India also has a lot of things to offer. The only thing is we have to, it's like playing tennis in your hometown or in the cricket in there and playing in another country that makes a difference, time difference, the climate. So here, when we are talking about Indo-American and DBT collaboration, I think we have to know the rules of the game. And no point in grumbling. Our team was grumbling, oh, they are asking this, they are asking that. We are not able to get that, I forgot the name of the numbers, where to register. So I think we are at least in process. I know Ronnie has gone through it, and every time I have troubled Ronnie also, how did you do it and can you teach us? And he's always ready to help. And I think one more, second project has already gone with the Sudha Iyengar. That is Madhavan and Rajiv Raman. So I think earlier, I think All India Institute had, and then when Carl first time, I think Shankar Netla had, Arvind had, and I think Arvind had a big project on Eels disease about 15 years back. So I think it's all in, and we have lots to offer, and for that we have to work hard. And I think more than working hard, I want to use the word, we work with passion. And I think we have a lot of people working for passion in their own institute, but I think now we have to have work for passion for Indian research. And we have I know Bakalesh Kamar from 80s, and he was the junior most that time, and I think he used to come and question Dr. Badrinath, why are you not doing this? And I'm sure he was there when Karl Kupfer was working with us. And I hope I can ask Bakalesh to tell something, because he's now, Dr. John, I don't know whether Bakalesh gave any comments. He's working in the, with
Absolutely.
the... Yeah,
Please.
no, he's worked with as a research vice president with Cadila. And I'd like him to tell a few words about research in India. And I think, no, you're one of our mentors, and before Ronnie George's time, you used to come to Shankar Netla. No, can you give your comments on research in ophthalmic research in India? And maybe Sandeep also to say something.
He still comes to Shankar Netla.
Yeah, I know he comes, but he has to stimulate us to work together. Yes, sir. Yes, Bakalesh.
Thank you for kind words. I don't deserve them. But my first interaction with NEI was through Karl Kupfer. So for the work we did on the cataractogenesis and medical therapy of cataract, it was presented at Asia Pacific Conference, and somehow it got notice of Dr. Karl Kupfer. He sends the word through Dr. Badrinath, because by that time he noticed it, the conference was over. I was back home in Ahmedabad, and then he sends a message through Dr. Badrinath that he would like to see me. And he gives a specific slot in Chennai. And then he met me. And I'm sure everybody knows him. He has a nicer way of doing it, things. He will not tell you upfront what he's going to do. He says, whenever you are in US, just send me a mail. And at that point in time, it was a year later, not emails. This was 85. And try to see me in NEI. I said, I was just assistant professor, and he's a director. I said, how is going to help me? But anyway, Since I said, I sent him a mail. And response I get is, what is the date convenient to you? I said, this is my plan and I can do this. So he said, okay, on a particular day, you come and give a talk at NEI on what you have done on catechinogenesis. So that was my first interaction with NEI. And in the same breath, I visited various universities and did things. Coming back to Indian part, see the DRCR network. I mean, in India, what we have to learn is to learn to work together. Learn to forget our personal or institutional priorities, and that's not happening. So if a DRCR network through DBT, if they can do it, say DRCR part of India, if it can be funded by DBT, then you don't have a funding requirement coming from US, and you don't have an obligation. You share some of the protocols where the investigators in India are willing to participate. DBT funds Indian part of it, which is their program, because that's, I think, the understanding between the two organizations. And then we can have some program running in India, start it, and then expand it. And I'm sure PGI, All India Institute of Medical RP Center, LVP, Sankar Nitralaya, Arvind, at least they can join if there's a common protocol coming from a DRCR network and there's a common meeting organized. Nati, this is for you. You can do this. You can call a meeting of a vitreoretinal surgeon interested in diabetic retinopathy in PGI, RP Center, LVP, Sankar Nitralaya, Arvind. Talk to Grover. Have some common protocol agreed. Apply for a DBT common program grant, where this part is funded by DBT, the other part is funded by NEI. In any case, it is funded. So they might have to share some software or access to the software through the computer network. And then you start going. The other point, I mean, since we are talking about diabetic retinopathy, and I saw one of them is persistent diabetic macular edema. As a part of faculty, we did some work some time back. Small study. Those who have persistent diabetic macular edema, in spite of injections and lasers, how do you do that? So there is a product in India which is available, which is a multi-component product, which includes TC inhibitor, statins, aspirin, beta blocker, and hydrochloride, diuretic. With that product, people start responding. It takes a little longer time, but they don't have to lose anything. We should start. And they regain the vision, the macular edema decreases. So a project like this can be taken up for this network, because this product may not be available in US, it's available in India. So this can be a starting point. Thank you.
All right, thank you so much. I think your feedback is just so good that that's a perfect segue for the next session, which is fortunately I'm co-chairing it, and Dr. Natarajan as well. So I would request that everyone stays where they are. Dr. Paul Baird, I would like to, in about a minute or two, he could come up to the stage to co-chair with me. But my co-chair and moderator of this session, Dr. Bhavna Chawla, would like to say something and officially close the session, but please stay in your seat and we'll begin the next session.
So thank you everyone for your participation and your active feedback and comments. They're really valuable in helping us, grow and achieve our objectives. So I hope really that you enjoyed this session and you got some good takeaway messages from this, and you all will start working on the R01 grant and the idea of collaborating and working together. Thank you. So can we have one photograph of the panelists and the speakers before we close this session?
You just want this session?
You have been to that? Yes. India and